Gillian de May's work schedule tells a story of intense pressure and rushed care for vulnerable elderly people. Allocated just 15 minutes for some home visits, she had to cram in as many as 15 appointments in a day.
Morning calls were particularly horrendous because you had to get people out of bed, coax them out of bed sometimes, wash them, dress them, make their breakfast. You didn't have time to talk to them, there was no compassion, there was nothing, you had to just rush out onto your next one.
She's quit her job and spoken out because she feared mistakes could be made, putting her patients at risk.
Doing this in the community is supposedly saving the government money because they're not going in homes. I mean, some of these people wouldn't even be alive if they didn't get a care worker. I think the consequences are people will probably not get the care they want and will die. I just felt that I was so stressed out, and it was just to me it was just a hopeless situation.
We shared Gillian's experience with the Department of Health. They agreed it's unrealistic and unfair to allow just 15 minutes to help people with things like washing, dressing or getting out of bed. We're working with councils to clamp down on rushed visits and have changed the law so they have to consider a person's well-being when arranging their care. But Gillian's former employer told us without money it's impossible. We just deliver what we're commissioned to provide, he said, adding, our hands are increasingly tied. He called for a wholesale review of the health and social care budgets. There's no doubt there is good care, but it costs. 92-year-old Enid Abbey counts herself lucky she's able to pay privately. She has 3 visits a week for 2 hours and always makes time for tea and a chat with her carer.
It's important to establish a rapport. There's no point in anybody coming and just rushing in and rushing out, and I don't really know very much about them, and they certainly don't know a thing about me.
This is the kind of care our whistleblower wanted to give, but she claims budgets made impossible, leaving the already fragile more vulnerable.